Hey everyone, this is Felecia. Welcome back to Money with Mission. Today we are having part 2 of my conversation with Dr. Virgie Ellington. If you didn't listen to part 1, go back to that because that is where she talks about how she was able to walk away from a job and a relationship that were not in her best interest. She had her finances in order, had passive income coming in. It is really exciting to hear this and to see how it was done, not in real time, but by a person who has done it in real life. Go back and listen to that one if you haven't. In this episode, we're going to talk about what she's doing, what she was put here to do. And you can tell by the excitement and the passion she has in her voice about what she's doing now to help ordinary Americans crush medical debt, avoid medical debt, understand insurance, i.e., health insurance, so that they can get the best out of it in the system that we have. We're going to have a part 3 on this conversation. It's not going to be following. It'll be a little while from now, but we're going to talk about health insurance just because I want to talk about it. Anyway, enjoy this episode. If you haven't, please subscribe to our podcast. Please subscribe to the newsletter. We promise not to inundate your inbox, and we only want you to get information that is beneficial to you. Thanks a lot, and I'll see you next week.
Be the change you want to see. Make a difference by giving your money a purpose, a mission to do good. Welcome to Money with Mission, where we show you how to create passive income so that you have options for how to work and how to live your life while leaving a legacy of positive social impact.
How you work with people, crushing their medical debt, teaching them about not ethical billing practices and that kind of thing. It's like, I was going to say another word, but I was like, okay, what's the best word I could say?
Be polite.
Predatory.
Like,
predatory.
Yes, ma'am. Nope. Yes. Yes.
So this is amazing because this also will, medical debt is one of those big debts that sends people to bankruptcy, and people include women, of course. And if you're out there and doing your thing, debt can be the thing, that medical debt can be that thing that keeps you in a relationship or keeps you in a job that is not serving you. Let's get into that. How do you help people with that?
So just to go into the numbers and people, unless it happens to you, people don't understand it's a thing.
Yeah.
So medical bills are the number one cause of debt and bankruptcy in the United States, period. And it's a uniquely American problem. And later, if you want, we can go into why that is and why it's never going to get better, frankly, unless there becomes that's eventually a public health option. It's the way the system is. It's going to get worse every year, each and every year, because the U.S. healthcare system, the American healthcare system, is run on the engines of publicly traded health insurance companies. And publicly traded companies, by law, by federal law, their number one job is to return a profit to their shareholders. Now, how are they going to do that? They better figure it out, and they have to do it each and every year. We can talk about how we got here and that kind of thing, but the point is, here we are, especially post-ACA, post-2010. The game has changed in terms of how to pay for medical bills. It's always been this way, but even more important now because the system is putting more of the cost on the patient, meaning cost sharing, high deductibles. And if the average deductible is about, I think the last I looked was about $1,400.
Okay.
And a deductible, by the way, annual deductible is how much you have to pay before the insurance company pays out, right?
Okay.
And every year when the clock drops January 1, the ball drops rather, clock turns January 1, the clock starts all over. So there's also data that shows, right? We've seen these numbers. Every year it changes a little bit. $400 to $500 is the most that many people, the average person in this country, can afford a bill that's more than $400 or $500 in the case of an emergency.
Yep.
So if you have something happen, no fault of your own. Is it your fault? Is it a character issue that you got sick? You diagnosed with a malignancy, a cancer, had an accident, an injury. Is that your fault? Is that a character issue? No, you didn't go out and spend money and go and buy Gucci and Prada. No, you didn't overspend on cars and fancy things and take, vacations that you didn't need, right? Or just take fancy vacations. No. So the thing is that when you're understanding this, that we're all at risk, unless you can afford to self-insure, you have resources, but the average American is just one accident or injury away from a lifetime of debt or bankruptcy or worse.
Yeah.
Last thing I talk about this in terms of just educating people about the global issue is that if medical bills in the United States are the number one cause of debt and bankruptcy, what's the number one cause of divorce? Financial problems, financial differences, money problems, money strain. So there's a direct relationship, a direct connection between medical bill and destroyed families, medical debt and destroyed families. And so unfortunately, because the providers, they're scrambling, it's in order for them to stay afloat, they have to get their money by any means necessary. And the easiest way to do that is to come after the patient. So that's just like the global picture I just wanted to share.
I want to
And
back up for
we're
just
going.
a second. Insurance companies drive me crazy. All insurance companies, but we're talking about health insurance company, which is also not a misnomer. We should call them what they really are. But
They're not. Thank you. I apologize. Please hold that thought. I do have to get that off my chest. I
Yes.
bring it up every time. Health insurance is not to protect you from a financial risk. It is not. It is there to give you, at best, their only job in the United States for health insurance companies, unlike any other insurance company, unlike homeowners insurance, unlike car insurance, it doesn't protect you from any financial risk. It gives you access to discounted medical care. So that's an important piece that I really want folks to hear, and I want you to hear and to discuss. We can discuss that. But part of the problem is that we think, like other insurance, that is to protect us from financial risk. No. Their job is all they do is give you, maybe if they decide to help you cover it, if it works out for their numbers, their formulas, to give you access to discounted medical services. That's it.
I never thought about it that way, but that is 100% true. I'd never thought about it that way. And people who aren't physicians, who don't, if you look at your explanation of benefits and you'll see what your doctor billed and you'll see what your insurance company paid, and it's that discount that you having that insurance gave you the ability to have. Does that make sense? I hope that makes sense to anybody who's not a physician. But look at your EOB is what it's called, explanation of benefits.
If you have insurance, say that
again.
If you have insurance, you get what's an EOB when services have medical services of any kind has been provided to you.
I never thought about that all the other insurance, we've got twisted thinking on that all the other insurances keep my house insurance, my car insurance keeps me from having to have this big bill come at me. That's not what insurance on my health is doing.
No, it's a completely different game. You got to learn the rules of the game. Otherwise, you're going to get destroyed. You're at risk of being destroyed.
And the fact, I want to just reiterate what you said, that all the major health insurance companies are publicly traded companies. And by law, their number one priority is profit to pay their shareholders.
Yes, ma'am.
Not to take care of you.
Exactly. It's
not
illegal.
To pay doctors.
It's illegal. That's right. It is illegal for them. They will catch a case. They will catch a federal case if they try to do the right thing, basically. Think about that. Yeah.
Well, everybody shifting in your seats. Take a deep breath. Okay.
I'm with you, folks. I'm squirming too. That's how I got here. Is, you know what, we need to, it doesn't have to be this way. It doesn't have to be this way. So it's interesting. You brought up something that you just triggered me to talk about this. And I don't necessarily talk about it all the time, but you brought up something to the point of being in a position where you can walk away, putting resources aside so that you can be your own bank. And that's what emergencies are for. When your income, you don't have income or won't have income for a year, forever how long, but to make sure that you're in a position where you don't have to do things that you don't want to do, and that in your gut, you don't know why. You may not be able to articulate even in your own brain why it's not right, but it's not right. And this I'm going to tell you. So I told you that it took me After I figured out what was going on with this insurance company and that it's now just numbers game, publicly traded,
Yeah.
all about the profit. And my mother passed away, and I was told, this major depression, that kind of thing. And I was saying, okay, I'm leaving him out. 3 months later, I said, and I gave him like a good 3 months notice. That was very kind of me. But why that's important, Dr. Froe, is that the last decision I made, or I should say, what put me over the edge in terms of making a decision to leave, was there was somebody very, very important to me who had been diagnosed with metastatic kidney cancer, renal cancer, basically.
Okay.
And she was basically my kid's nanny. And when I got married, left Manhattan, moved, and she was no longer taking care of my kids, obviously, who didn't live close to her anymore. She was taking care of another family. And she knew to call me if she had questions or something came up. But I had thought, you know what? There's a problem here. I'm working all of these hours, 10 to 12 hours a day, and it's not enough for them, right? Saved them $50 million additional and wait, what? It's still not enough? What? Something is not right, because I said, you know what? I haven't talked to my nanny. I didn't have time to reach out to her just touch base and connect with her, check in with her. I always depended on her to reach out to me if there was a problem.
Yeah.
And there's a difference, right?
Yeah. Yes.
And if she probably just thinks out of sight, out of my mind, she's out of mind, right? She doesn't know how much I love her, and I want to make sure she's okay, and I want to take care of her, make sure she's taken care of, I should say. And I was like, you know what? I am less than 5 years out from a breast cancer diagnosis, and I'm late for my annual screening mammogram because I don't have time, because I work these 10, 12 hour days, and it's still not enough. And I was like, that's when I said, I'm out. That's what really put me over the edge, was those two things. So I'll never forget it. I got up on a Thursday, the first Thursday of September. That was my last day in the job. Friday. And it set up my mammogram for the following Thursday. So less than 1 week, right? I got a call 1 week later that my annual mammogram was abnormal in the morning. That was a call I got in the morning. That afternoon, I got a call from my nanny's daughter, who lived outside of the States and couldn't get back into the States. And she called me and she said, Virgie, my mom has been admitted to hospice and I can't get back into the States. Can you, I'm going to get emotional.
Yeah.
She just said it. She didn't ask the question. She said, I can't get back into the States. And my nanny died. I got up the next morning. That was a Thursday. The next morning, I got up. My plan was to work in the business full time, but I got up the next morning. Every single day, I get up every single morning and sit with her in hospice, except for 2 days. I had my breast biopsy from the abnormal lesion, and the next day I still was sore.
Yeah.
So 2 days, I missed those 2 days. She died on a Wednesday, 3 weeks later. The following Wednesday, I had my double mastectomy for aggressive. People in medicine knows what triple negative breast cancer is. There's different cancers that are more aggressive than others. The ugly one is triple negative receptor breast cancer. So
that's a second breast cancer.
That's my second one, exactly. First one was right. The second one that they found was on the left, that they found less than 1 week after I got up from my job, or I didn't have time to make I was late for my mammogram. Yes, ma'am.
Mm-hmm.
Because I had surgery, I was having surgery the next morning, I couldn't go to my nanny's funeral, which was the night before. Had surgery. I woke up and my surgeon said to me, she says, okay, Virgie, you know what, is just in the lymph node. So you're good. I'm sorry, not in the lymph node. I'm misspeaking. Apologies. The word I'm trying to say is it's just in the duct. It did not break outside of the duct.
Okay.
And we sent it to pathology, while you're under, they do a frozen pathology, they send it to make sure it's okay to decide if they have to take out more, right? And they wait to hear back. So I talked to the pathologist, and the duct is clean. Our margins are clean. You're good, right? Now, this is in the middle of the pandemic. I'm like, awesome. I'm good. She calls me the next day at home and she says, Virgie, I am so sorry. She said the pathologist called me and he said he really is uncomfortable there is only 1 millimeter border of clean, of non-cancerous area outside of the duct. She says, we're going to have to go back in. We're going to have to go back in and take out more of the tissue surrounding that duct where that breast cancer, that lesion was, that cancer was.
So at that point, you did not have the double mastectomy. They were just trying to resect the lesion.
So we did the double mastectomy, but there was an area in the lymph node that they were concerned about, where the duct, that was the tail of the duct heading into the lymph node.
Gotcha.
And they hadn't taken the whole thing.
Gotcha.
Right?
Gotcha. Okay. Okay.
So I can laugh, right? I can laugh now. But she says, okay. And so this is when they shut down non-emergency surgeries. So there was no scheduled surgeries, period, in this point in the pandemic. That was like the next week. We said, okay, we'll schedule it. And then the country shut down non-elective, understandably, surgeries. Yeah. You just had to sit there. Some people knew they had malignancies, by the way, had cancers that they couldn't get out because they weren't, that was considered
it wasn't considered an emergency.
Exactly, right? So 3 months later, they have it taken out. And the thing is that that's when it hit me that 1 millimeter, and of course it was fine. They just wanted to take out more of the margin, just get rid of the rest of the tissue. But the point is 1 millimeter was between this malignant, very aggressive, nasty cancer that would have killed me within 2 years, easy, door to door. 1 millimeter, that's days from breaking through the duct, not weeks, not months. That stuff was on a mission. It was going to break through. If I had not gotten up from that job when I did, days. If I had taken another week to say, okay, I'm out, I wouldn't be here. And so my boss, who was going to put me on the PIP, I knew she felt really bad about it. Whatever. On our last day, she sent me an email saying, we're going to miss you so much and your laugh. And what I'm really going to miss about you is your laugh. And when I thought about that after my surgeon said 1 millimeter, we're going to have to go back. Sorry. We thought it was not safe. It's not comfortable. It's not really safe. I thought, well, yeah, you're going to miss my laugh. Oh, okay. But my kids would have missed me forever.
Yes.
Yeah. So there's a long drawn out story, Dr. Froe, but I wanted to share it because you said something about making sure we're in a position that we don't have to stay in a marriage, a position, we don't want to move just because of money.
Yeah.
Be your own bank.
I don't even know what to say about that, but that was so good. Just such a perfect example of being able to do what you feel is right. You didn't even know all that other stuff was going on.
Exactly. Listen to that tiny, tiny voice. And you can't articulate it, but you're like, something is not right. I don't know what it is, but I've got to something is not right. And there's a saying that people say, God speaks to you initially in a whisper. And if you let the noise around the system of things in the world keep you from hearing it, it gets louder and louder and louder until you have to address it. So it would have been metastatic by the time I'd figured it out. If I didn't listen to that tiny voice, I didn't know what it was. I was like, this is not right. I don't have time to take care of and reach out and make sure the people I love are taken care of. And I can't take care of me.
Take care of myself.
What?
This is
no. Mm-mm.
And so many women and men, but we're talking about women mostly, take care of everybody else before they take care of themselves, not realizing that not taking care of yourself puts everybody else at risk.
You can't take care of
everybody else.
People know that. Now they know, okay, you can't take care of anybody else unless you take care of yourself first. But it's insidious is the problem. We don't realize that that's what we're doing until sometimes it's too late.
And it is very insidious. We know it in our head, but it doesn't, you don't do it. We don't do it. We still take care of everybody else, are run down, don't get our sleep. We could go on and on about that. All right. This is so good. Crushing medical debt. So who comes to you? Who are your clients? Who do you work with?
So there are two things. Our initial plan was to work with folks I wrote the book and I do the podcast, the weekly podcast, the Voice America Internet Radio.
Say the name of your podcast and your book.
The name of the book is What Your Doctor Wants You to Know to Crush Medical Debt, but it's just Crush Medical Debt for short. And the name of the show is on Voice America Weekly, Crush Medical Debt, Medical Bills Uncovered. So I do that for free, basically, because you don't have to buy the book if you want to get the information. So if you listen to it enough, you're going to get all of the things that I tried to pour into the book. And basically the 3 steps of the only right way to pay a medical bill. So this is a long answer to your question. My ideal client is the average American patient, meaning somebody living in the United States who has to interact with the American healthcare system.
Everybody. Okay.
Everybody, whether you have insurance or not. And whether you're documented or not, doesn't matter. If you're a human being, right? That has to go. No human beings are illegal, right? Yeah. If you're a human being living in the United States, eventually long enough, you're going to have to interact with the American healthcare system. This is for you. Anybody who's living in the States and has to interact with the American healthcare system. Okay. So that's my ideal client. Okay.
And do they come with you with debt already, or are they not just, but are they, it's like, since it happens to everybody eventually, how do I keep myself and my family from being a victim to medical debt?
So because I use the word debt, a lot of I'm changing that for this reason. A lot of people's eyes glaze over and they're like, I don't have medical debt, and just walk away.
Yeah.
I'm like, yet.
Yes.
You're not old enough. You haven't been around the system. You haven't been around the system of things long enough yet.
Yeah.
So I'm working on changing the name to say is to prevent. My goal is to prevent you from getting into debt. But to answer your question, the people that come to me, they're already in debt. If you're concerned about this, you already have this problem. You're looking for a solution.
Yeah.
So those are the folks that come to me. They're listening to the show. They'll write into the show, email me, that kind of thing. Word of mouth. I'll help people. You can't pay me to do this work because it's thousands of dollars per hour worth of work. I do it for a mission and to try to give people basic medical financial literacy. Because in the United States, without it, we're the only country. This is a uniquely American problem, uniquely a United States problem. In the United States, without basic medical financial literacy, you're at risk. You have no protection for your future.
Yeah.
You're at risk.
Yeah. So I like your thought of changing to uncovering medical bills, or
it's called Medical Bills Uncovered is the name of the weekly show.
Yeah. Because even an explanation of benefits, you kind of stare at it to understand what the heck they're trying to tell you.
Exactly. And I teach people, whether you have insurance or not, how to make sure that you're not taken advantage of. You don't become a victim of predatory medical billing. There are 100 million and more growing every year for reasons I discussed prior. American medical cost victims in the United States. And so there's a lot of folks out there that need this information that don't know. They're still trying to pay their bills the old way, meaning with more debt, chasing, God forbid, but some do home equity loans, sell their homes, empty out their IRAs.
Yeah.
No. By the way, folks, never empty out your IRA, no matter how bad it is. You need to declare bankruptcy, because IRAs, your retirement plans, are 100% protected in bankruptcy.
Yes.
Please.
Yes. Don't do that.
Never. It could save your life. I'm here to say, you know what? That could save your life.
So many things we could talk about IRAs and all that. We're in a medical debt. One thing I learned, let's put it go this way. One thing I learned, there's times I have insurance, there's times I just don't want to use it. I'm like, it makes no sense. And then I find out that if I pay cash for something, it costs half as much as if they bill my insurance company.
Yes, ma'am.
Like, I'll just pay for that.
Exactly. I'll buy that for $1. Yeah. And there are many people who can't afford to pay cash, though. And this is why we have these conversations. Yes.
I get it. Oh, I remember. I was going to ask an example of predatory billing. Can you give an example of that?
Yeah, I'll give you an example. So, I have tons of them.
You're like, which one should I pick?
Yeah, exactly. From which to choose. There's a myriad from which to choose. So my favorite example is this. I'll tell you my favorite example. So after my second breast cancer surgery, I had one of the things was a major hysterectomy and everything, a major abdominal surgery, that there would be no hormones whatsoever that could make anything grow. If anything got past it from the first breast cancer that was hormone sensitive, it's a PR, they call it PRHR positive. So we said, you know what? Just clear everything out. Anything that could make a hormone is gone, right?
Okay.
So my surgeon, my gynecological oncologist surgeon said, okay, in the first post-op follow-up appointment, said, okay, Virg, you're all set. You don't have to come back except for whatever checkup, maybe once a year or whatever. He says, but it was 6 weeks after, what was it? I'm sorry, 3 weeks after. He says, for the next 6 weeks or something like that, he says, no lifting. First, he said no sex and no lifting. And I'm like, wait, for 6 weeks or something. No, I'm sorry. That's not right. I wouldn't have been so upset if it was just 6. It was 3 months. Let me get it right. Virgie, no sex. It was a vaginal hysterectomy where they take instead of cutting you, right?
Yeah.
You take everything out, tubes, ovaries, everything, and they cut through the vagina and pull it out. And no lifting. And my first response was, I was like, no sex for 3 months. I was like, have you seen my husband? I was like, and I was like, oh, okay, just whatever. And then the second thing I said was, I said, no lifting for 3 months. And this was in my head at this point. And then I said, well, I have chickens. And he was like, what? Rightfully, understandably. So I was like, did I say that out loud wrong? I said, yes, I have chickens and they need to eat. They need to be fed. And their feed comes in these big 35-pound bags. And he says, decant them, have somebody decant them into 5-pound bags and no lifting more than 5 pounds. It's like, psst. So you know where this is going, right? So I did my lifting, whatever. And this is why you always have to listen to your docs, people. And doctors make the worst patients. You don't lift when you have abdominal surgery, so you don't undo the incision that's sewn back together, right? I undid my incision. And I didn't realize it until my bowel had gotten caught in it. I was going septic. I was laid out. I was sickest. And it was bad. It was bad. People talked about giving last rites, that kind of thing. And I was like, I really, really messed up. Virgie, really? Okay.
Okay, I gotta ask the question. Was it the lift in the chicken feed or was it the sex? Or do you
Yes.
You don't have to answer that question.
Yes. Yes. I was hoping you wouldn't ask, but I opened myself up to it. The answer is yes. We'll just leave it there.
Okay. All right.
That's what it was. Exactly. Yes, ma'am. You got it. So although the surgeon, the gynecologist, the gynecological surgeon who fixed it said it really wasn't the sex. She said it was the lifting. It was.
Okay.
I was like, well, it was my birthday. I was like, I thought it was like 6 weeks. I thought it was.
What is enough?
Close enough. It was like 1 week. I thought it was close
enough. Like, okay.
You got it. Yeah. So I was like, Virgie, if you wake up and you don't hear ICU noises and bells, you're going to be okay. But you might have really effed up. And so I woke up and I didn't hear any ICU noises. I was like, okay, Virgie, you dodged that bullet. You're going to be okay. But I heard snoring. I was like, holy crap. I have a roommate. I'm in a semi-private room. And usually when I go and have to have surgery, I ask for a private room. Virgie, you were really shot out. You were really sick because you weren't aware enough for a room. Okay. But my hospital roommate was this really young, sweet young mom of 2 toddlers. And she wasn't working because her kids were too young to be in school yet. Okay. And her husband, her insurance is through her husband's work, which was at a 24-hour diner. So very clearly modest income. And we're talking and she says, yeah, she had been there for like almost a week. And this was the second time in 1 year because there was an issue that came up that they were concerned she was having like a rare cause of a stroke in a really young person, right?
Okay.
So they were keeping her there for all of these tests and la, 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 la. She says, but you know what? I think I'm going to leave, even though they want me to stay. And I said, well, why would you do that? And she says, because I know I can't afford this. She said, the last time I was here, when I was leaving, the day I was being discharged, a representative from the hospital came into my room and said, before you can leave, just keep that in the back of your mind. What? Were you kidnapping her? Wait, what? Before you can leave, you have to sign this document. And she said the document said that if whatever her insurance did not pay, she would agree to pay whatever her insurance didn't pay. And she said, I said, you signed it? She was like, yeah. Of course she did. Right?
Yeah.
And the other thing is English is not her first language. Young, not clear that she had any education outside of high school. Anyway. And she tells me this. And when she said that to me, Felecia, I swear to God, the curtain dropped. I saw red. I was enraged just because I knew she had been deliberately tricked into signing an agreement to pay a bill she doesn't owe. What she was tricked into signing a bill to an agreement
Contract.
to be balanced billed.
Yeah.
Holy crap. And I thought, you know what, Virgie? No, don't get angry. Don't get mad. Get to getting. And that's how Crushed Medical Debt was born. I wrote the book and it did the show for Mia. Her name was Mia. And there's 100 million Mias in the United States and growing every year.
Yeah. People sign that. I probably would have signed it because
right.
Of course, I'm going to pay what my insurance doesn't pay because that's
that's called balance billing. That's contract fraud. No. The reason why you pay your premiums for health insurance is to get discounted medical services. And it's a contract between, so the provider goes to this insurance company and says, hey, insurance company with let's say 1 million potential patients for us, we will give you hugely discounted rates on our made-up fantasy number. So it looks like you're getting a huge discount in exchange for your members, in exchange for you sending your members to us. We'll be in net. That's called being in network.
Yeah.
So let's say, and the numbers, the ratios sound outrageous, but it's really, really common. Let's say a service is $100. That is the retail, what I call the MRSP, manufacturer retail sticker price for a medical service.
Okay.
The insurance company will say, okay, we'll pay you $10 flat, not counting the deductible or if co-insurance, but we will pay you $10. And that's it. You, in exchange for being in our network, our members will pay you $10. So that's why there's these outrageous numbers that hospitals allegedly charge. Those are they're totally fantasy made up numbers, right?
Yes.
So the difference, the balance of between $100 and $90 is when an insurance company, the provider comes to you and says, hey, yeah, that payment we got from your insurance, that was only $10. We charge $100. You owe us the $90, the difference. And that's what they conned her, that's how their system got down. And later I found out they got in trouble by the state. I don't know if it was for that, but for some other shenanigans, but trying to get money because they can't get it from the insurance companies. Who are they going to get it from? The American patient, folks living in the United States who don't know the game and don't know the system, right? So that's my favorite example because that's how Crushed Medical Debt was born.
Okay.
Fast forward 6 months later, oh my gosh, I get a bill from that visit. They saved my life. Great. And that's why people feel we love our nurses and we respect and appreciate our docs. And that's why we're like, we Americans, we want to pay the bill. And that's what we're counting on. Right. Anyway, so I get a bill from them for basically, it was like 3 lines. First line was OR services and hospitals daily, like $351. Sorry, $351,000. Excuse me, $351K. Right. And the second line said insurance adjustment, something like $260K, $260,000. And then it said patient responsibility. I still can't stop laughing. It's been years. It said basically $90,000 patient responsibility. And so this is in the middle of a weekday, right? And I just cannot stop laughing. And I had to get it off my chest. So I call my best friend and she's a city attorney. And so if I call her in the middle of the day, it better be important, right? She knows I'm not going to bother. Well, I do bother her, but anyway, that's my job. That's her job as my best friend, right? So it's my job to bother her. So anyway, so I called her and I told her, look, these people sent me a bill. The hospital sent me a bill, a balance. I didn't say the word balance, but I said they sent me a bill after allegedly what the insurance paid for $90,000. And I'm cracking up laughing, right? And I said, this is a balance bill. And I'm just, I can't stop laughing. And she's quiet. And finally she says, you know what, Virgie? You're the only one I know who's laughing when everybody else would be in a corner, curled up in a fetal position in a ball, crying.
Yes.
And she says, you got to get this information out to folks. And I said, oh, definitely. I'm making copies of it. That ended up in the book. Yes, ma'am.
Yeah. Virgie, this has been so good. I've learned so much. I love hearing your stories. How can people get in touch with you? Say again your book and your show, because if doctors need to listen to it, doctors need to send their patients to it. Doctors get put into the bad category of we're taking so much money, we're billing so much.
We get blamed for everything. And let me tell you this, docs don't know what's going on. As of this 23, I think it was last year, officially more than half of physicians are employed. And so that means that they have no idea what's going on in the back office. It's two separate universes, right?
Yes.
If physicians knew what was being done to their patients in their name by destroying their financial lives, which causes stress causes high cortisol levels, which causes type 2 diabetes, increases your risk for type 2 diabetes. Stress, debt makes you sick. There's a direct relationship. If physicians knew, we would be ape crazy. I'm not going to swear. So anyway,
How do we find you?
For it.
How do we find you?
To answer your question, I'll answer your question. You can find me, you can go to crushmedicaldebt.com, or you can find me at, if you want to email me, try me at dr.virgie, V-I-R-G-I-E, at crushmedicaldebt.com. And you can hear Medical Bills Uncovered, Crush Medical Debt, Medical Bills Uncovered at voiceamerica.com, internet radio. And that is every week on the Empowerment Channel. It is 9 a.m. Eastern, 12 p.m. Pacific every Thursday.
9 a.m. East. You guys, we're going to have this in the show notes. That didn't 9
show notes. All right. 9 a.m. Eastern, 12 p.m. Pacific every Thursday.
How? If it's 9 a.m. Eastern, it's 6 a.m. Pacific.
I'm sorry. You know what? You're absolutely right.
All right.
And the thing is, people complain about chemotherapy brain. It supposedly takes some brain cells. I didn't even have to have chemotherapy. I don't have anybody to blame but myself. Yes, thank you for bringing that up, Dr. Froe. Voice America on the Empowerment Channel, Crush Medical Debt, Medical Bills Uncovered at 12 p.m., 12 noon Eastern, 9 a.m. Pacific.
Yes. It has been so good having you on the show. I had such a good time. This was such important information. We may have you back to just go deeper into some of this stuff, because this is, I know we're going to come back and talk about
women. I'll be
how
back.
We're going to change the medical system in the United States.
How we're going to make sure that that we get rid of predatory medical billing, period. We're going to do this. We can do this. You got it.
We're going there. Okay. Thank you, everybody. Thank you so much. See you next week.
You've been listening to Money with Mission. There are projects happening right now where you can have a great financial return while positively affecting the lives of others. To learn more about our opportunities, go to moneywithmission.com.